Good morning to all. In last class, I have discussed about anti-Parkinson drugs classification and mechanism of action of levodopa. So in today's class, I'm going to discuss about pharmacokinetics of levodopa and pharmacodynamics of levodopa and drug interactions and adverse effects of levodopa and other anti-Parkinson drugs mechanism of action and their uses and side effects. Okay, and so first of all, I'm going to discuss about the pharmacokinetics of levodopa. Okay, so first, what is pharmacokinetics? Pharmacokinetics means what body does to the drug. That is called as pharmacokinetics. What is pharmacodynamics? Pharmacodynamics means what the drug does to the body. That is called as pharmacodynamics. Okay, so pharmacokinetics of levodopa. So here the levodopa, it is actively absorbed by oral route. Okay, it is absorbed orally by active transport mechanism. Okay, and the absorption of this levodopa, it will be decreases in the presence of food. Okay, especially amino acid containing food. Okay, so that's why this levodopa should be administered on empty stomach. Okay, and the bioavailability of this levodopa, it is affected by amino acid containing food. Because of this amino acid present in food, it is compete for the same carrier for absorption. Means what? Okay, so that amino acid and the levodopa, it can utilizes the same carrier. Okay, to cross the intestinal wall. Okay, the purpose of crossing the intestinal wall is what? Absorption purpose. Okay, so here that amino acid and the levodopa, it will amino acid is present in food. Okay, so that amino acid absorption requires the same carrier, and the levodopa absorption requires that same carrier. Okay, so both amino acid and levodopa, both things are utilizes the same carrier to cross the intestinal wall. So the purpose of crossing that intestinal wall is absorption purpose. Okay, and that's why this levodopa drug, it should be given 30 or 60 minutes before meal. Okay, so levodopa should be taken on a empty stomach. Okay, and the distribution of this levodopa is it is crosses the blood-brain barrier. Okay, and the plasma T-off of this levodopa is 1 to 2 hours. Okay, and what is the metabolism of levodopa? Okay, so this levodopa, when it is taken by oral route and when it is used alone. Okay, so in that cases 95% of this levodopa, it will be metabolized in peripheral region only. Okay, it will be degraded in peripheral region only. Okay, here there are two kinds of enzyme is there, that is catechol O methyl transferase and dopa decarboxylase enzyme. Okay, so the levodopa, it is converted to dopamine in the presence of dopa decarboxylase enzyme. Okay, or the levodopa is converted to 3-methyl dopa. Okay, in the presence of catechol O methyl transferase. Okay, so the levodopa decarboxylation process is happens in peripheral region only in the presence of peripheral decarboxylase enzyme inhibitors. Okay, so when it is used alone, 95% of this levodopa, it will decarboxylated in that peripheral region only. The remaining 3% of this levodopa, it can crosses the blood-brain barrier. Okay, then it is reaches to what? Brain. Okay, then in this brain consists of same COMT enzyme is there, dopa decarboxylase enzyme is also present in that brain. Okay, so that's why the levodopa is also converted to dopamine in the presence of dopa decarboxylase enzyme. Okay, and or the COMT, the catechol O methyl transferase enzyme is required for the conversion of levodopa to 3-methyl dopa. Okay, so here the levodopa is get converted to dopamine in the presence of dopa decarboxylase enzyme. Okay, so this dopamine again, it is converted as dopac, that is 3,4 dihydroxy phenyl acetic acid. Dopac means, okay, phenyl acetic acid. So in the presence of which enzyme? MAO-B means mono amino oxidase enzyme B. So in the presence of this enzyme, dopamine it get converted to dopac. Okay, and dopamine in the presence of COMT, it is converted to 3-methoxy tyramine. Okay, again 3-methoxytyramine is converted to homovanillic acid in the presence of monoamino oxidase enzyme B. Okay, then dopac is also converted as homovanillic acid in the presence of COMT. Okay, so finally the metabolic product of the dopamine is homovanillic acid. Okay, so here the levodopa, it is a precursor of dopamine. Okay, actually the dopamine, Parkinson disease occurs due to loss of dopaminergic neurons. Okay, it is occurs due to lack of activity of dopamine and excessive activity of acetylcholine. Okay, so here the metabolism of levodopa, if it is used alone, means 95% of this drug it is decarboxylated in peripheral region only. Only 3 to 5% of this levodopa it can crosses the blood-brain barrier. Okay, so that's why the levodopa always used along with what? Peripheral decarboxylase enzyme inhibitors. So the name of this peripheral decarboxylase enzyme inhibitors is what? Carbidopa and benzerazide. Okay, so if it is used along with the peripheral decarboxylase enzyme inhibitors, means what? So there is no conversion of levodopa to dopamine in peripheral region. Okay, so then what will happen? The more levodopa it can crosses the blood-brain barrier. Okay, if it is used along with the peripheral decarboxylase enzyme inhibitors, means the more amount of levodopa it can enter into the brain region. Okay, because of that inhibitors is inhibit the decarboxylation of levodopa in peripheral region. Okay, and so this one is metabolic process of what? Levodopa. Okay, finally the end product of dopamine is homovanillic acid. Okay, here the COMT and MAO-B inhibitors are required for the metabolism of dopamine. Okay, and dopa decarboxylase enzyme is required for the conversion of levodopa to dopamine in the brain. Okay, and the drug the drug it will be metabolized in GI, mucosa and liver. Okay, and the drug it can be excreted through what? Urine. Okay, and next, what is the pharmacodynamics? Okay, pharmacodynamics of levodopa. What is pharmacodynamic? Dynamic means what? Pharmacodynamic means what the drug does to the body. That is called as pharmacodynamics. Okay, so what is the levodopa effect on CNS? Okay, so first thing is it is effective in eliminating the most of the symptoms of Parkinson disease. Okay, so Parkinson disease is characterized by what? Bradykinesia, rigidity, and tremors. Okay, so the symptoms of this Parkinson disease, it will reduces. Okay, first bradykinesia and rigidity is respond quickly. Okay, then reduction in the tremor effect with the continuation of this therapy. Okay, bradykinesia means what? Slowness in movement. Rigidity means what? Stiffness. Okay, tremors means shaking movement. Okay, then handwriting and speech, facial expression, interest in life also improves gradually. Okay, so micrographia means small handwriting. Okay, means the letters of this the size of the letter is small. Okay, so it is a one kind of symptom of Parkinson disease. Okay, so here the levodopa effect on CNS is what? The person handwriting it will be improves, the speech and facial expression, the interest in life is also improves very gradually. Okay, and the final the response is general alerting response. The levodopa, it is stimulate the what kind of response? The general alerting response, it will be stimulated. Okay, nothing but it shows the excitement, and okay, it may cause us the psychosis also. Okay, in case of overstate, it may also cause us the psychosis. Okay, first it relieves the symptoms of Parkinsonism disease. First one is it reduces symptoms, reduces the what bradykinesia effect and rigidity effect. Then, as a result of continuation therapy, there is a reduction of the tremors. Then slowly, the handwriting it will be improves. The way of speech and facial expression, the interest in the life is also improves gradually. Okay, and next, what is the effect on CVS? Okay, so the dopamine, it will be formed in peripheral region. Why? Because of in the presence of peripheral decarboxylase enzyme, the dopamine, the levodopa, it get converted to dopamine in the peripheral region. Okay, so what is the effect of dopamine on heart? Okay, so heart consists of beta receptors. Okay, heart consists of what kind of receptors? Beta receptors. So the dopamine effect on heart is what? Tachycardia. Because of the dopamine, it is stimulate the what kind of receptors? Beta receptors. So that's why the dopamine effect on heart is tachycardia, because of dopamine is stimulate the beta receptors. Okay, and dopamine, it causes the postural hypotension. What is postural hypotension? Postural hypotension, it is also known as orthostatic hypotension. Okay, so what is the meaning of postural hypotension? Means the person BP, it will drops abnormally. Okay, when they stand up after sitting or after lying down position. So that is called as postural hypotension. Okay, so here actually dopamine in peripheral region, the dopamine effect on heart is what? Tachycardia. Okay, but at the same time, the dopamine is causes the postural hypotension. Why? Because of the dopamine, it causes the postural hypotension due to central action of dopamine. Okay, the central action of both things, dopamine and noradrenaline. Because of noradrenaline, it is synthesized from the dopamine only. Na means what? Noradrenaline. Okay, so noradrenaline, it is synthesized from the dopamine. Here the dopamine is causes the postural hypotension due to the central action of what? Dopamine and noradrenaline. So as a result of central action of dopamine and noradrenaline, then what will happen? There is a decrease in the sympathetic outflow. Okay, the sympathetic outflow, it will be what? Decreases. Why the sympathetic outflow is decreases? Because of this excessive formation of dopamine. Means the variable levels of dopamine in autonomic ganglia, it may block the ganglionic transmission. Okay, as a result of blockade of ganglionic transmission, there is a decrease in the sympathetic outflow. Okay, so as a result of decrease in the sympathetic outflow, then what will happen? The person may affected with what? Postural hypotension. Okay, so the peripheral action of dopamine and heart is tachycardia. Okay, the central action of dopamine and noradrenaline is what? Postural hypotension. Okay, postural hypotension means what? The person BP, it will drops abnormally when they stand up after sitting position or after lying down position. That is called as postural hypotension. So this postural hypotension is mainly occurs due to central action of dopamine and noradrenaline. Because of it, decrease in the sympathetic outflow. Why decrease in the sympathetic outflow? Because of the excess dopamine in autonomic ganglia, it may block the ganglionic transmission. Okay. Next one is CTZ. So what levodopa effect on CTZ? Okay, so the CTZ consists of dopamine receptors. Okay, so here the levodopa, it is stimulate the what dopamine receptors in CTZ. Okay, because what the levodopa, it can crosses the blood-brain barrier. Okay, so here in peripheral region, the levodopa, it converted as dopamine. Okay, in the presence of peripheral decarboxylase enzyme inhibitors. Okay, so here the dopamine, it does not crosses the blood-brain barrier. Okay, Only levodopa it can crosses the blood-brain barrier. So the dopamine does not crosses the blood-brain barrier. Okay. So here the CTZ is present outside of the blood-brain barrier. Okay. So that's why here the dopamine, what the dopamine, it is activate the dopamine receptors in CTZ. Okay, then what will happen? The person may affected with nausea and vomiting. Why? Because CTZ means what? That is chemo triggered zone. Okay, CTZ means what? Chemo triggered zone. It is a vomiting center. The vomiting center is present in medulla oblongata. Okay, so here peripheral formed dopamine, it is activate the CTZ. So after activation of CTZ, as a result of activation of CTZ, the person may affected with nausea and vomiting. Okay, and next one is endocrine. Okay, action on endocrine system. Okay, so here the levodopa, it can decrease as the prolactin levels. Okay, and decrease in the levels of prolactin and decrease in the levels of growth hormone also. Okay, and next, levodopa drug interactions. Okay, so here the first drug interaction, when the levodopa used along with pyridoxine. Okay, then what will happen? The therapeutic effect of levodopa is decreases. Why pyridoxine is decreased in the therapeutic effect of levodopa? Because, listen carefully, because pyridoxine, it is increases the peripheral decarboxylation of levodopa. Okay, so peripheral, as a result of peripheral decarboxylation of levodopa, then what will happen? Only the less amount of levodopa it can crosses the blood-brain barrier. Okay, then what will happen? The less amount of levodopa it can crosses the blood-brain barrier, means what will happen? The therapeutic effect of levodopa is decreases because of the less availability of levodopa in central region. Why? While less amount of levodopa is available in central region, because this pyridoxine drug is causes the decarboxylation process in peripheral region. Okay, so that's why the low amount of levodopa only it crosses the blood-brain barrier. So that's why when pyridoxine is used along with the levodopa, means the therapeutic effect of levodopa, it will be decreases. Okay, and then the second drug interaction is antipsychotic drugs. Okay, so when the levodopa used along with antipsychotic drugs. Okay, antipsychotic drugs examples here: phenothiazines, butyrophenones. So these drugs are block the dopamine receptors. Okay, so block the dopamine receptors. Then what will happen? Block the actions of levodopa, phenothiazines and butyrophenones. So why block the actions of levodopa? Because these antipsychotic drugs are block the dopamine receptors. Then what will happen? The levodopa, after conversion of dopamine, it binds with the dopamine receptors only. Okay, then only the dopaminergic neuron activity is increases, the dopamine neurotransmitter levels is increases, the dopamine actions it will be increases. But as a result of blockade, of these dopamine receptors, then what will happen? The dopamine is unable to bind with dopamine receptors. So then what will happen? The therapeutic effectiveness of the levodopa, it will be decreases. Okay, and the next one is anti-dopaminergic drugs. Okay, so the anti-dopaminergic drugs example is domperidone. Okay, so this domperidone, it is a D2 receptor antagonist also. Okay, so here this domperidone, it does not crosses the blood-brain barrier. Okay, so it is an anti-emetic drug. Okay, so this domperidone, it relieves the symptoms of nausea and it decreases nausea and vomiting. Okay, so but here when anti-dopaminergic drugs used along with the levodopamines, what will happen? What kind of effect will be produced? Okay, so here there is no anti-Parkinson effect. There is no anti-Parkinson effect. Why? Because domperidone, it does not crosses the blood-brain barrier. Okay, so it does not affect. There is no effect on D2 receptors in basal ganglia. Okay, then what is the main what drug interaction? What? Okay, so when this domperidone, when domperidone is used along with the levodopamines, It blocks the levodopa induced nausea and vomiting. Okay, but there is no effect on anti-Parkinson. Uh, what there is no primary anti-Parkinson effect. Okay, only it relieves the nausea and vomiting, levodopa induced nausea and vomiting. Okay, why it is relieve the levodopa induced nausea and vomiting? Because levodopa does not cross as a blood-brain barrier. Okay, so here what the domperidone it does not act on dopamine receptors which are present in brain region. Okay, in basal ganglia region. Okay, so only it is block the dopamine receptors which is present in CTZ only. Okay, not in brain region. Okay, so that's why when this domperidone used along with the levodopa, it relieves the nausea and vomiting. Okay, but no influence on primary anti-Parkinson effect. Okay, next anticholinergic drugs. Okay, so here dopamine is actually occurs due to loss of dopaminergic activity, loss of dopaminergic neuron, or overactivity of acetylcholine. Okay, so here when this levodopa used along with anticholinergic drugs it can shows the synergistic action. Okay, but anticholinergic drugs having one property, that is anticholinergic drugs are delays the gastric emptying. Okay, so as a result of delay the gastric emptying, then what will happen? The therapeutic effect of levodopa, it will be decreases because of the drug, the levodopa drug, it will be available more time for peripheral decarboxylation. Okay, because of these anticholinergic drugs are delays the gastric emptying. Okay, and the next thing is non-specific monoamino oxidase inhibitors. Okay, this non-specific monoamino oxidase inhibitors are prevents the degradation of what peripheral synthesized dopamine. Okay, so in peripheral region the levodopa it converted as dopamine. Okay, then the dopamine it get convert the dopamine is converted as noradrenaline also. Okay, so the dopamine effect on heart is what? Tachycardia. Okay, and the noradrenaline effect on heart is what? It is also tachycardia and increases the hypertension, vasoconstriction, like effects it will be produced, noradrenaline effects. Okay, so here non-specific monoamino oxidase inhibitors are prevents the degradation of peripheral formed dopamine. Okay, so when this monoamino oxidase inhibitors used along with the levodopa means what? It prevents the degradation of dopamine. Monoamino oxidase inhibitors are prevents the degradation of dopamine in peripheral region. So as a result of prevents the degradation, okay, as a result of prevents the degradation of dopamine, then what will happen? The concentration of the dopamine, okay, the amount, the drug amount, okay, so the concentration of dopamine it will be increases in peripheral region. Okay, nothing but the production of the noradrenaline is also increases. So then what will happen? The noradrenaline effect and the dopamine effect in heart is what? Tachycardia. Okay, then it may cause us the hypertensive crisis. Okay, so the combination of monoamino oxidase inhibitors and levodopa means the person may affect with hypertension. Okay, because of this monoamino oxidase inhibitors are prevents the degradation of peripherally synthesized dopamine. So if degradation is synthesis degradation is degradation is prevented means the concentration of dopamine is very more. Okay, the dopamine action in heart is what? The peripheral form of dopamine action on heart is what? Tachycardia. So nothing but it causes the hypertension. Okay, and next one is adverse effects. Okay, so adverse effects of what? Levodopa. Okay, so euphoria. Okay, first CNS adverse effects. Okay, so euphoria means what? Means it is a feeling of what excitement, okay, and anxiety, okay, agitation, okay. Insomnia means unable to sleep, okay. Psychological disturbances like confusion, delusion, and hallucination is also occurs, okay. And euphoria means excitement, agitation means is a state of anxiety, okay. Insomnia means the person is unable to sleep, okay. And other psychological disturbances is confusion, delusion, and hallucination. And dyskinesia means what? Abnormal involuntary movements, okay. Dyskinesia means abnormal involuntary movements. So this abnormal involuntary movements, it can be corrected by dose reduction. So this dyskinesia is occurs due to variable levels of dopamine, okay. So if dose reduction is happens means the abnormal involuntary movements, it will be corrected by dose reduction. And what is the GI symptoms? That is anorexia. Anorexia means loss of appetite. Okay. And nausea and vomiting is also occurs due to what? Stimulation of D2 receptors in CTZ. Okay. So due to stimulation of D2 receptors in CTZ, the person may affected with anorexia, nausea, and vomiting. Okay. So these kind of symptoms, it can be relieved by anti-emetic drug, that is domperidone. Okay. So domperidone, it is a D2 antagonistic drug. This drug is does not process the blood-brain barrier. Okay. So when this domperidone, it blocks the T2 receptors in CTZ. Okay. So this the levodopa, it is causes the anorexia, nausea, and vomiting. So this kind of symptoms, it will be relieved by antiemetic drug. The name of this drug is domperidone. Okay. And constipation is also occurs, and bleeding peptic ulcers may also occurs. Okay. So these are the GIT related adverse effects. Mainly is nausea and vomiting, anorexia. So the symptoms it will be relieved by using antiemetic drugs. Okay. And the main benefit of this domperidone, it does not process the blood-brain barrier. It is only block the D2 receptors which are present in CTZ only. Okay. And what is a CVS adverse effects? Okay, that is postal hypotension. So that postal hypotension is occurs due to decrease in the sympathetic outflow. Okay, so why decrease in the sympathetic outflow? Because of in central region, means the dopamine, it will be formed in ganglia also, autonomic ganglia also. So the excess level of dopamine in autonomic ganglia, it may block the ganglionic transmission. Then what will happen? There is the sympathetic flow, it will be decreases. Okay, so that's why the person may affected with postal hypotension. So this postal hypotension is mainly occurs due to the central action of dopamine and noradrenaline. Okay. But not peripheral action of dopamine and noradrenaline, only the central action of dopamine and noradrenaline. Okay, because of the central action of dopamine and noradrenaline is decrease in the sympathetic outflow. Okay, why decrease in the sympathetic outflow? Because of it block the autonomic ganglion. Okay, block the ganglionic transmission. Okay. uh, Next, tachycardia. Okay. The peripheral dopamine, it is stimulate the what? Beta 1 receptors. Okay, that's why it causes the tachycardia. Okay, because of heart consists of beta 1, beta 2 receptors. So this dopamine action on beta 1 is stimulatory effect. That's why it person may affected with tachycardia. Okay. And hypertension, it may also occurs with uh, large doses or with non-selective monoamino oxidase enzyme inhibitors. Okay, so this monoamino oxidase enzyme inhibitors are prevents the degradation of dopamine in peripheral region. Okay, then what will happen? The dopamine activities increases at the peripheral region. So what is the dopamine activity on heart is what? Tachycardia, the person affected with hypertension. And one more thing is also activate the alpha 1 receptors. Okay, as a result of activation of alpha 1 receptors, there is a hypertension is also occurs. Okay, and other adverse effects is alteration of smell and alteration of the taste sensation and abnormal facial movements also. Okay, in case after prolonged therapy of this levodopa, okay, after prolonged therapy of this levodopa, then what will happen? That is a wearing off phenomena. Okay, wearing off effect it will be produced. So what is wearing off means? It is a one kind of complication. Okay, so this complication that may occurs after few years of usage of this levodopa. So after few years is nothing but 3 to 5 years. So after prolonged therapy, that is 3 to 5 years of this levodopa, then what will happen? Mm, the duration of beneficial effect, it will be become short as a therapy is progress. As a therapy is progress, the duration of beneficial effect, it will be decreases. Okay, then the disease control becomes very poor. Okay, the disease control becomes very poor, and there is a fluctuations in the symptoms. Okay, so the parkinson symptoms, it may occurs very frequently. Okay, so why this wearing of effect it will be produced after prolonged therapy of this levodopa? Because of this may be occurs due to interaction of dopac. It is obtained from the dopamine. Okay, so the dopamine, it is converted to dihydroxy phenyl acetic acid in the presence of mono amino oxidase enzyme B. Okay, so here the interaction of dopac with H2O2. Okay, so it may lead to what? There is a toxic oxygen free radicals. So the toxic oxygen free radicals, it will be produced as a result of interaction of dopac and H2O2. Okay, so after formation of this toxic oxygen free radicals, these toxic oxygen free radicals will destroy the dopamine storage vesicles. Okay, so then what will happen? The dopamine storage vesicles, it will be destroyed means the person may affected with parkinson symptoms. Okay, so that's why there is a fluctuations in the symptoms, it is occurs very frequently. Okay, so this kind of wearing of effect, it will be prevented by adding one more category of the drug, that is mono amino oxidase enzyme B inhibitors. So mono amino oxidase enzyme B inhibitors, example salicylin. Okay, so as a result, this drug is inhibit the which enzyme? Mono amino oxidase enzyme B. So there is no conversion of dopamine to dopac. Okay, then what will happen? There is no interaction of dopac with H2O2. Then there is no destroy of dopaminergic storage vesicles. Okay, so this wearing of phenomena, it will be prevented by adding monoamino oxidase enzyme B inhibitors. Okay. So after prolonged usage of this levodopa, that wearing of phenomena, it will be occurs. It is one kind of complication. So this complication is occurs after a few years use of this levodopa. So in this, what will happen? The duration of beneficial effect is will be reduced. Okay, and the disease control becomes very poor, and there is a fluctuations in symptoms is occurs very frequently. Okay. Mm, Next, after due to variable levels of this dopamine. Okay, due to variable levels of dopamine in CNS, so there is a on off phenomena is occurs. Okay, what is on and off phenomena? So it is switch. Okay, it is a switch between mobility and immobility in levodopa treated patient. Okay, it is a switch in between mobility and immobility in levodopa treated patient. So in on state, what will happen? The patient enjoys the normal mobility, and in the normal state, physically, mentally, the person, it will be normal. Okay, in off state, there is a loss of beneficial effects of the drugs. Okay, so for example, the person is unable to rise from chair. Okay, on which he had a sat few minutes ago. Okay, so this kind of state, it is occurs due to fluctuations in plasma levels. Okay, so there is a fluctuations in plasma levels, it occurs because of short off life of this levodopa. Okay, so that's why this on and off phenomena is occurs due to variable levels of dopamine in the CNS. Okay, if it is on state, if it is the concentration of dopamine in plasma levels is in therapeutic range, the therapeutic range of dopamine is present in plasma means in CNS means what, it is in on state. Okay, the patient enjoys the normal mobility and mentally and physically is good. Okay, but there is a fluctuations in the plasma levels of this dopamine, and there is a fluctuations in the levels of dopamine in the CNS region. Then what will happen, the person may lose the beneficial effects of these drugs. Okay, so this may things occurs due to short life of this levodopa. Okay, so these are the adverse effects of levodopa. Okay, CNS disturbances, GIT disturbances, CVS disturbances. In after prolonged therapy, it may cause us the wearing of phenomena is occurs, and on off phenomena is also occurs. Okay, and the next category of these drugs is peripheral decarboxylase enzyme inhibitors. Okay, so peripheral decarboxylase enzyme inhibitors example is carbidopa and benserazide. Okay, so here this carbidopa, it decreases the what kind of enzyme, uh, peripheral decarboxylase enzyme. See this DDC, peripheral dopa decarboxylase enzyme, dopa decarboxylase enzyme. Okay, so carbidopa benserazide, these drugs are inhibit the dopa decarboxylase enzyme. Okay, in peripheral region. Okay, then as a result of blockade of this enzyme, then what will happen, the levodopa that does not cross does not convert the dopamine. Okay, there is no decarboxylation of levodopa because of this carbidopa, and benserazide is inhibit the dopa decarboxylase enzyme. Okay, so then what will happen, there is no conversion of levodopa to dopamine means the more amount of levodopa it will crosses the blood-brain barrier. Okay, the more amount of levodopa it crosses the blood-brain barrier means the levodopa it can convert it to dopamine. Then dopamine is binds with the dopamine receptors in basal ganglia. So it relieves the symptoms of Parkinson disease. Okay, so that is a mechanism of action of carbidopa. Okay, so this carbidopa it does not crosses the blood-brain barrier. Okay, mind it, what carbidopa does not crosses the blood brain barrier. Okay, if it is crosses the blood brain barrier means what will happen, just imagine carbidopa, it is inhibit if it is crosses the blood brain barrier means what will happen, it is also inhibit the dopa decarboxylase enzyme in central region. If it is inhibit the dopa decarboxylase in central region means what will happen, the levodopa does not crosses the dopamine in central region, then there is no therapeutic effect of levodopa. Okay, so that's why this carbidopa does not cross as the blood-brain barrier. Okay, so that's why this carbidopa only inhibit the dopa decarboxylase enzyme in peripheral region only, not in central region. Okay, and the dose combination of this carbidopa is levodopa along with carbidopa, that is 4:1 or 10:1 ratio. Okay, and the levodopa along with the benserazide, that is 4:1. Okay, ratio. And the main advantage of these combinations is what increases the bioavailability of dopamine in basal ganglia. Okay, so the more amount of levodopa it can crosses the blood-brain barrier means it will the availability of the drug in basal ganglia is increases. Okay, and the dose of the levodopa it can be reduced by 75%. Okay, the dose of the levodopa it can be reduced by 75%. Why? Because of the more amount of levodopa it can crosses the blood-brain barrier means there is no need of giving the extra dose. Okay, um, the prolongation of off-life of levodopa is increases. If it is used alone, if levodopa it is used alone, means the off-life of levodopa is should be short, that is 1 to 2 hours. If it is used along with the peripheral decarboxylase enzyme inhibitors, means the off-life of this levodopa it may be increases, it may increases. Okay, and it decreases the systemic concentration of dopamine. Okay, and it is decreasing the incidence of GI side effects. Okay, so in peripheral region the dopamine concentration it will be decreases. Okay, and it may decreases the GI side effects also. Okay, so it decreases the concentration in peripheral, it decreases the dopamine concentration in peripheral regions, means the cardiovascular complications is also decreases. Okay, because of dopamine action on heart is what? Tachycardia. Okay, there is a cardiovascular complications is occurs. Okay, due to this one, the dopamine. Okay, excessive concentration of the dopamine it may causes the tachycardia in case of in peripheral action of dopamine and heart is tachycardia. Okay, so here by using of this carbidopa and benzerazide, what will happen? The cardiovascular complication it will be minimized, GI side effects it will be minimized. Okay, and next thing is dopamine agonist. Okay, dopamine agonist it is an alternative to levodopa. The next category, it is a alternative to levodopa, and this will act on striatal dopamine receptors. Okay, striatal dopamine receptors even in advanced patients. Okay, and it does not requires any enzymatic conversion. Okay, this dopamine agonist does not requires any enzymatic conversion because of it is a dopamine agonist. And example is bromocriptine. Bromocriptine it is a ergot derivative. Okay, it is obtained from ergot alkaloids. Okay, it is ergot derivative, and it does not require any enzymatic conversion to form a active metabolites. And it drug having long duration of action, then levodopa, and this drug is prevents the motor complications. Okay, and the main mechanism is it is a agonist, it is a partial day 1 receptor agonist and strong day 2 receptor agonist, means it is potentiate the activity of dopamine, it is stimulate the dopamine as it is activate the dopamine receptors, especially D2 receptors. Then what will happen? The dopamine it is easily binds with the dopamine receptors, and it is potentiate the activity of dopamine in the basal ganglia region. Okay, so that's why the motor activity it will be becomes to normalized in Parkinson disease patients. Okay. Mm, what is the uses of this bromocriptine? Okay, it can be used alone or it can be used along with levodopa also, and it can be used alone and it can use as adjacent to levodopa. Okay, and it is improve the symptoms of, it is improve the effect of wearing off and on off phenomena and of on off fluctuations, and it is improve the complication of wearing off phenomena. Okay, and it is used in the suppression of lactation because of this drug is suppress the prolactin level. Okay, so and acromegaly means excessive growth. Okay, the excessive growth is occurs due to overproduction of the growth hormone. Okay, so here this drug what bromocriptine. Bromocriptine it is used in the treatment of acromegaly. Okay, because of this bromocriptine it is suppress the growth hormone. Okay, so that's why it is used in acromegaly and ACTH dependent tumors, adrenocorticotropin hormone dependent tumors. Because of this drug is inhibit the ACTH hormone. Okay, and adverse effects of this bromocriptine is hallucination and confusion and vomiting. And the contraindication of this drug is peptic ulcer, and myocardial infarction and mental illness. Okay, and pargolide. Next drug is pargolide, and this one is also ergot derivative. And mechanism is it is a D1 and D2 receptor agonist. Okay, this drug is also stimulate the dopamine receptors. Then the dopamine, it is easily binds with the dopamine receptor and the potentiate the activity of dopamine in the basal ganglia region, so that the motor activity of the motor activity, it will be becomes to normalized in Parkinson disease patients. And the kinetics is it is absorbed orally and it is metabolized in liver by cytochrome P450 enzyme system. And the drug, the bioavailability of this drug is only 50%. Okay, why bioavailability is only 50%? First, because of that drug is undergo the first pass metabolism. So what is first pass metabolism? So the drug, before going to the systemic circulation, the drug should be metabolized in the liver. Okay, so then what will happen? The drug before going to the systemic circulation, it will metabolize in the liver, means the availability of the drug in systemic circulation, it will be decreases. Okay, so that's why the availability is 50%. And the drug can be excreted through urine. Okay, and the use of the drug is used for the treatment of idiopathic Parkinson disease treatment. And adverse effect is dyspepsia and constipation and hallucination also. And the main interaction, it is pergolide, it is when used along with ciprofloxacin. Ciprofloxacin, it is an antibiotic. Okay, it is a fluoroquinoline derivative. Okay, and diltiazem, it is a calcium channel blocker and it is used for the treatment of angina. Okay, so when pergolide used along with this antibiotic and diltiazem, then what will happen? What kind of interaction is happens? So that is the metabolism of pergolide, it is decreases. The metabolism of pergolide is in decreases because this drug metabolism requires CYP, that is cytochrome P450 enzyme 1A2. Okay, this is an enzyme. This enzyme is required for the metabolism of pergolide. Okay, but here the ciprofloxacin and diltiazem, it is inhibit the this enzyme, the CYP1A2 enzyme. So as a result of inhibition of this enzyme, then what will happen? The metabolism pergolide, it will be decreases. Okay, then therapeutic effectiveness of this pergolide, it will be increases. Okay, and the next one is rompindrol. Okay, so in next class we will discuss about the remaining drugs which are present in what dopamine agonist. Okay, rompindrol, pramipexole. Okay, and the remaining monoamine oxidase inhibitors, COMT inhibitors, anticholinergic drugs. So these categories of drugs we will discuss in next class. Okay.